I'm Dr. Steve Teitelbaum, and you're watching the Plastic Surgery Channel.
Hi, I'm Dr. Bill Adams, Chief Medical Officer of the Plastic Surgery Channel, and welcome to PSC Hot Bites, our newest program where the channel's experts cut to the chase and provide real answers to questions you want to know on hot plastic surgery procedures, topics, or technology. We want to dispel the myths and marketing spin that often plagues patients and help you get the real story from our credible team. Joining me today via webcam is Dr. James Grotting from Birmingham, Alabama. Jim, great to have you on with us.
Thanks, Bill. It's great to be here.
Let's switch gears a little bit to another topic, and that's the treatment of the fatty neck and chin. I know you have some experience in this. There's a new option out there called a scarless treatment for the fatty neck and chin. What patients are candidates for that type of treatment?
Yeah, Bill, it's an exciting new area of plastic surgery. Of course, we're always trying to get good results through more minimal incisions, through smaller operations, sometimes with no operation at all. But there are a group of patients, younger patients, who tend to have an inherited tendency toward a very round or heavy neck, the jowl area and the neck area. Even younger patients in their 20s and 30s tend to have this bulkiness there that makes them look like they're overweight when they're really not. And if you take a look at their mom and dad, oftentimes they have the same kind of shape to their face. So there is a way of shaping that tissue by really think of it as micro-liposuction, or as very carefully controlled, refined sculpting of the jowl and the neck area. And we found that the most effective way to do this is with the use of ultrasound. There are some very tiny little probes that can be inserted just at the base of the ear through a teeny tiny little incision, and we can think of it almost like melting the fatty tissue very carefully, very slowly. And oftentimes it's not the amount of fat that's removed, but the location of it that can help create a more triangular shape to the jaw area and can really improve the way the neck looks and make a patient look like he or she has lost weight, and in many cases just look younger and more aesthetically pleasing. And then in the older group of patients, even though as most people age, we tend to lose fat in our face, but there's lots of patients that tend to still have quite a bit of heavy fatty tissue through the I'm not sure if I just cut you off, but at any rate, this older group of patients that also may have some laxity of the skin will benefit by this sculpting, this refinement of the fatty tissue through the jaw area and the neck area, along with a lifting operation. And oftentimes the removal of fat in that area allows us to do the lifting operation through a shorter incision, which makes the recovery time faster. So the take-home lesson here is that oftentimes making the face look better or younger is not just a matter of pulling or lifting skin, but it's the shaping of the face, and particularly in this area through the jaw and the neck, that has really improved our results.
So Jim, I really want to thank you for taking time out of your busy day to visit with us.
You're welcome, Bill. Thank you.
And we hope you enjoyed this segment of PSC Hot Bites, and be sure to get your next bite on our website, theplasticsurgerychannel.com. Until then, we'll see you soon.
I'm Dr. Steve Teitelbaum, and you're watching the Plastic Surgery Channel.